I implore you, with the utmost sincerity, if you or someone profoundly important to you is contemplating cataract surgery, then under no circumstances proceed without first comprehending and implementing the vital information I am about to share. As an ophthalmic surgeon with over 2 decades of dedicated practice, I have been privileged to witness thousands upon thousands of profoundly successful outcomes. I have seen countless individuals reclaim their vision, literally watching as they rediscovered a world previously obscured by a cloudy haze, a clarity they had mournfully believed was lost to them forever. The joy and relief on their faces, the renewed engagement with life, is truly one of the most rewarding aspects of my profession. However, alongside these triumphs, and this is what truly burns within me and compels me to speak to you with such unvarnished directness, I have also encountered preventable complications. Genuine tragedies that transformed what should have been a straightforward, routine procedure into an agonizing, life-altering nightmare. I am not exaggerating the gravity of this situation. What I am poised to reveal in this comprehensive guide are the absolutely crucial steps, the non-negotiable considerations, and the unmistakable warning signs you absolutely must be aware of to safeguard your precious eyesight and guarantee that your cataract surgery is not merely adequate, but a resounding, unequivocal success. This isn't just a collection of helpful tips, it is your meticulously crafted map, your indispensable compass for navigating a medical process that, despite its widespread commonality, remains exquisitely delicate. Stay with me until the very end, and I promise you will leave empowered, knowing precisely what questions to pose, what standards to demand, and what critical details to scrutinize under the metaphorical microscope before entrusting your eyes, your window to the world, to any medical professional. Your vision, the very essence of how you experience and interact with your environment, is far too invaluable to ever leave to chance or overlook with complacency. Every single year, millions of individuals across the globe undergo cataract surgery. It stands remarkably as the most frequently performed surgical procedure worldwide, boasting one of the highest success rates in the entirety of modern medicine. Yet, it is precisely within the comforting embrace of this impressive statistic that the gravest danger resides: complacency. This pervasive sense of ease, unfortunately, often infects both patients and, regrettably, even some medical professionals, leading them to approach cataract surgery as nothing more than a simple formality, a mere part replacement that demands minimal attention or intricate planning. Listen closely, because this, without a shadow of a doubt, represents the initial and most profoundly perilous misstep one can make. While it is undeniably true that modern cataract surgery, powered by advancements in technology, is a true marvel of precision and efficacy, delivering breathtaking results for many, the attainment of truly spectacular success, the kind that allows you to effortlessly read the smallest print, drive confidently at night without fear, and once again perceive the vibrant, vivid colors you may have long forgotten, does not hinge solely on the brief 15 to 20 minutes you spend within the operating room. Instead, and I would argue this constitutes at least 90% of the equation, it absolutely relies upon a meticulous, comprehensive preparation process that commences not days, but weeks prior to the scheduled procedure. This crucial preparatory phase, sadly, is frequently either glossed over by numerous patients, not elucidated with the essential detail it merits by some practitioners, or simply taken for granted by all involved parties. It is for these reasons, precisely because I have personally witnessed the devastating consequences of hasty decisions and a profound lack of critical information, the specter of infections that can imperil the entire eye, the frustration of inaccurately calculated lenses that condemn individuals to perpetual reliance on thick bottle-bottom glasses, or the ordeal of protracted and painful recoveries, that I implore you to pay close attention. In the vast majority of these unfortunate cases, these problems directly stemmed from a failure to diligently complete the preoperative homework I am about to outline for you. Before we delve into the core specifics, I feel it is imperative to debunk a persistent myth, a genuine relic of ophthalmology from 4 decades past, a misconception I still, to my dismay, frequently encounter in my own practice. the notion of waiting for the cataract to mature before proceeding with surgery. In bygone eras, surgical techniques were indeed cruder and far less refined. Under those circumstances, it made a degree of practical sense to delay intervention until the eye's natural lens became exceptionally opaque and hardened, making its removal more feasible with the tools and methods then available. However, with the advent of groundbreaking modern technologies, such as phacoemulsification, utilizing ultrasound, and advanced laser systems, the exact opposite holds true. Attempting to operate on a cataract that is exceedingly advanced or overripe necessitates the application of significantly more energy to dissolve the hardened lens material. This increased energy directly translates into a cascade of undesirable outcomes: heightened inflammation within the eye, a substantially slower and often more uncomfortable recovery period, and, most critically, a considerably elevated risk of post-operative complications. Therefore, if anyone advises you to wait until you can barely see before considering surgery, I urge you, without hesitation, to seek an immediate second opinion from a different, well-regarded ophthalmologist. The modern golden rule for cataract surgery is no longer about how little you can perceive on an eye chart. Rather, it is fundamentally about the extent to which the cataract is actively diminishing your overall quality of life. If your daily activities, your hobbies, your independence, or your general well-being are being negatively impacted by blurry vision, then it is likely time to consider intervention irrespective of the maturity of the cataract. Now, let us turn our attention to what truly matters. Drawing upon my extensive 2 decades of clinical experience, I have distilled the essence of a truly successful cataract surgery into what I refer to as the 3 pillars. By thoroughly understanding and actively mastering these 3 foundational principles, you will not only be equipped to skillfully circumvent the most prevalent and potentially devastating complications, but you will also decisively seize control of your own visual health, transforming yourself from a passive recipient of care into an active, informed participant in your journey to clearer vision. Pillar 1, the diagnosis, beyond the superficial. The key diagnostic studies you must demand. It is simply not enough for an ophthalmologist to briefly examine your eye with a slit lamp and declare, yes, you have a cataract. That cursory assessment is merely the very beginning of the diagnostic journey, akin to a mechanic listening to your car's engine, hearing an unusual noise, and simply stating, yes, your engine sounds strange. Would you feel reassured by such a superficial diagnosis? Of course not. You would rightly demand a comprehensive scan, precise measurements, and a complete, in-depth evaluation of your vehicle's intricate systems. With your eyes, which are immeasurably more valuable and irreplaceable than any automobile, you must be even more discerning and demanding. A truly successful cataract surgery is, at its core, an exercise in millimetric precision, a procedure where accuracy, down to the smallest fraction of a millimeter, directly dictates the quality of your visual outcome. This unparalleled precision is 100% dependent on a series of specialized preoperative diagnostic studies that are, and I want this truth to be indelibly imprinted upon your mind, absolutely non-negotiable. If your chosen clinic or surgeon either fails to conduct these essential tests or, worse, attempts to downplay their profound importance, consider that a monumental red flag, a stark warning sign that you should not ignore. These are the specific studies you absolutely must ensure are performed, and, more importantly, that you fully comprehend why each one is so profoundly vital to your visual future. First and foremost is optical biometry, the tailor for your new lens. Imagine the intraocular lens, IOL, that will be placed inside your eye as a bespoke suit, custom-tailored to your unique anatomy. The biometry scan is the sophisticated study that meticulously takes the precise measurements of your eye, providing all the necessary data to craft that perfect suit. This isn't just a single measurement. It encompasses several critical parameters. It accurately gauges the exact length of your eye, known as axial length. the available space for the new lens, anterior chamber depth, and the curvature of your cornea, which is the clear front window of your eye. All these intricate data points are meticulously fed into incredibly complex mathematical formulas, algorithms that then calculate the exact power required for your new intraocular lens. What happens if this critical calculation is flawed or inaccurate? The result is what we in the medical community term a refractive surprise. You undergo surgery, envisioning a future free from dependence on distance glasses, only to discover, to your profound disappointment, that you still require a significant glasses prescription to see clearly at a distance. This outcome is, tragically, one of the most common causes of patient dissatisfaction following cataract surgery. Today, the gold standard for this crucial measurement is optical biometry, performed by interferometry. This cutting-edge technology utilizes a non-contact laser system, making it astonishingly fast and precise, down to the level of microns, ensuring the most accurate lens power calculation possible. Devices like the IOL Master or LensStar are the recognized industry benchmarks for this advanced technology, while ultrasound biometry, a contact method, was historically used and still has a role if a cataract is so dense that it obstructs laser penetration. Optical biometry is overwhelmingly superior whenever feasible, offering unparalleled accuracy. Your mission, then, is to ask your doctor directly and without hesitation, is the biometry you plan to perform optical? And specifically, what brand or model of equipment do you use for this test? A truly proficient and confident professional will be proud of their advanced technology and eager to explain its benefits. If you receive evasive responses or a dismissive attitude regarding the importance of the equipment, exercise extreme caution. Second, you must demand corneal topography and tomography, the 3D map of your eye. The cornea, as mentioned, is the transparent outermost layer of your eye, and it serves as the most critical refractive surface responsible for a significant portion of light focusing onto your retina. A corneal topography scan generates a detailed, color-coded map of your cornea's surface, much like a topographical map of a mountain range, revealing every subtle curve and elevation. A tomography takes this analysis even further, providing a comprehensive 3D cross-sectional view, analyzing not only the front surface but also the back surface and the precise thickness of the cornea at every single point. This detailed mapping is absolutely vital for several crucial reasons. Firstly, it allows us to accurately detect and catch astigmatism. A substantial number of people have some degree of astigmatism and are completely unaware of it. If this astigmatism remains undetected and uncorrected during surgery, typically with a toric intraocular lens, which we will discuss later, you will continue to experience bothersome visual artifacts such as shadows, ghosting, or distorted images, necessitating ongoing reliance on glasses even after cataract removal. Secondly, these scans are indispensable for ruling out hidden corneal diseases. A topography or tomography can uncover underlying issues like keratoconus, a progressive thinning and outward bulging of the cornea. If keratoconus goes unnoticed and unmanaged, proceeding with routine cataract surgery can lead to a catastrophic failure of the procedure or even pose significant risks to the eye's long-term health. Lastly, this detailed corneal map is indispensable for selecting the correct intraocular lens. Certain subtle irregularities or abnormal curvatures in the cornea can render more advanced lenses, such as multifocal or extended depth of focus (EDOF) IOLs, ineffective or even cause them to generate poor quality vision and unacceptable visual disturbances. Without this comprehensive map, your surgeon would effectively be flying blind into your procedure. Your mission here is to directly inquire, does my preoperative workup include corneal topography or tomography? And based on these scans, do I have astigmatism that can be corrected during the same surgical procedure? The answer to this seemingly simple question holds the potential to radically alter and optimize your postoperative visual outcome. Third on our list is the endothelial cell count, the quality control for your cornea. This particular test is among the most profoundly important, yet, regrettably, it is also one of the most frequently omitted in hurried, express preoperative evaluations. The innermost layer of your cornea possesses a unique and vital single layer of cells known as the endothelium. The primary function of these remarkable cells is to actively pump fluid out of the corneal tissue, thereby maintaining its essential transparency. Think of them as the vigilant guardians responsible for keeping the window of your eye perfectly clear and crystal-like. The critical issue, however, is that these endothelial cells do not regenerate. We are born with a finite number, and they gradually diminish throughout our lifetime. Moreover, the very act of cataract surgery, specifically the ultrasound energy used during phacoemulsification, inevitably causes the loss of a small percentage of these delicate cells. If an individual already possesses a lower than normal density of these cells prior to surgery, perhaps due to genetic predisposition, previous eye trauma, or an underlying corneal disease, and the surgery further depletes their numbers, the cornea can irreversibly lose its precious transparency. The devastating consequence is a condition known as corneal edema, an unchecked swelling of the cornea that causes persistent, severe, blurry vision and can, in unfortunate circumstances, become permanent, ultimately necessitating, in extreme cases, a full corneal transplant. An endothelial cell count is a remarkably quick and non-invasive test that simply captures a high-resolution photograph of these cells and then counts their density. If the cell count is found to be low, the surgeon can take specific, proactive precautions during the procedure, employing less ultrasound energy, utilizing specialized protective gels to cushion the endothelium, or, in borderline cases, informing you that your inherent risk of corneal edema is elevated, allowing for informed consent. Your mission, and this question is paramount: will I undergo an endothelial cell count? And critically, what is the health status of my corneal endothelium? To proceed with cataract surgery without this vital knowledge is, quite frankly, an act of sheer imprudence. Finally, we come to macular optical coherence tomography, OCT, the X-ray of your retina. After thoroughly examining and assessing all the anterior, front, structures of the eye, it is absolutely imperative that we confirm the health and integrity of the posterior back segment, the delicate photographic film where the incoming images are projected. This critical film is the retina, and its central, most vital area, responsible for processing fine details and central vision, is called the macula. You could undergo a technically perfect cataract surgery with a perfectly calculated and implanted intraocular lens, but if you harbor an underlying problem within your macula, be it age-related macular degeneration, AMD, a macular edema, an epiretinal membrane, or any other pathology, your post-operative vision will, regrettably, remain suboptimal, failing to meet the expectations of clarity. Cataracts, due to their inherent opacity, frequently conceal these underlying macular issues. If these problems are not meticulously identified and evaluated before surgery, the disappointment and frustration experienced by the patient afterward can be immense. The patient, having hoped for perfect vision, is left to realize that such a result was anatomically impossible from the outset. Macular OCT is a revolutionary, non-invasive scanning technology that provides an incredibly high-resolution, cross-sectional image of the retina. This allows the surgeon to visualize even the most minute alterations or subtle pathologies that might limit the final visual outcome, ensuring that realistic expectations are set and that any treatable conditions are addressed proactively. Your mission here is clear. Demand a complete retinal evaluation. Ask your surgeon, does my preoperative assessment include an OCT scan to evaluate the health of my macula and retina? This particular study is absolutely fundamental not only for establishing accurate and realistic post-operative expectations, but also for diagnosing any other retinal problems that may require separate, concurrent, or future treatment. Mastering this first pillar signifies that you will not enter the operating room blindly, hoping for the best. Instead, you will proceed with a clear, strategic battle plan, meticulously informed by precise diagnostic data, and with the profound assurance that the likelihood of encountering unexpected, unwelcome surprises has been dramatically minimized. This diligent approach sets the foundation for a truly optimized visual outcome. Pillar 2, the choice of the intraocular lens, IOL. How do you envision seeing for the rest of your life? If our first pillar was firmly anchored in the principles of safety and precision derived from comprehensive diagnostics, then this second pillar is entirely about personalization. This is the pivotal juncture where you, the patient, wield the most significant power to actively decide and shape how you desire to perceive the world for the many years ahead. Regrettably, it is also an area rife with considerable confusion and often insufficient guidance. Decades ago, the selection process was remarkably straightforward, almost rudimentary. Essentially, only one type of lens, the monofocal IOL, was readily available. Today, however, the landscape of options has expanded exponentially, presenting an extensive and often overwhelming array of choices, and critically, understanding these distinctions becomes your personal responsibility. There is no single, universally best intraocular lens that suits everyone. Instead, there exists only the best lens specifically tailored for you. This profoundly personal choice cannot and should not be based solely on price, considerations, or simply on what type of lens your friend or neighbor received. It absolutely must be grounded in a meticulous analysis of your unique lifestyle, encompassing your cherished hobbies, your daily professional activities, and, most importantly, your specific visual aspirations and expectations for life after surgery. To illuminate these distinctions with greater clarity, let us employ a simple yet effective analogy. Consider intraocular lenses as different types of shoes. You wouldn't wear heavy-duty hiking boots to a formal wedding, would you? Each shoe serves a distinct purpose, offering different advantages and trade-offs. Let's explore the primary categories of IOLs. 1. Monofocal lenses, the specialized running shoes. This represents the standard, classic intraocular lens option. As its name implies, monofocal means it possesses a single, fixed point of focus, much like a pair of high-performance running shoes designed for a single, specific activity. Typically, this lens is precisely calculated to provide you with superb, crystal-clear distance vision. With a monofocal lens, you will enjoy watching television, reading road signs while driving, or admiring a distant landscape with remarkable sharpness and excellent contrast. The trade-off, however, is that for nearly all other visual tasks, you will almost certainly require corrective eyewear. You will, with high probability, need glasses for reading, for viewing your smartphone or tablet, for working at a computer, for deciphering prices at the grocery store, or for detailed tasks like applying makeup. While it offers fantastic optical quality within its designated focal range, its overall visual utility is, by design, limited. Who is this lens ideal for? It is perfectly suited for individuals who have absolutely no objection to continuing to wear reading glasses for near tasks, those who primarily prioritize the absolute highest quality of distance vision, such as professional drivers or outdoor enthusiasts, or individuals who have certain pre-existing retinal conditions that would make more complex lens designs less suitable or potentially detrimental. 2. Multifocal lenses, bifocal and trifocal, the versatile office shoes. These advanced lenses are true marvels of ophthalmic engineering. They incorporate multiple distinct zones of focus within a single lens, functioning much like progressive glasses, but seamlessly integrated within your eye. This innovative design allows you to focus clearly at various distances: far for driving or scenery, intermediate for computer screens, dashboards, or looking across a room, and near for reading or intricate close-up work. The overarching objective of multifocal lenses is to liberate you from the constant reliance on glasses for the vast majority of your daily activities. The trade-off, however, is that this sophisticated technology comes with certain visual concessions. By cleverly dividing incoming light into multiple focal points, you may experience a slight reduction in contrast sensitivity, particularly noticeable in dimly lit environments. Furthermore, it is quite common for patients to perceive visual phenomena such as halos, rings of light around bright sources, or starbursts, streaks of light emanating from point sources around lights at night, such as car headlights or street lamps. While the majority of people successfully adapt to these phenomena over time, with their brains learning to filter and ignore them, for some individuals, particularly those who frequently drive at night or have a heightened sensitivity to light, these effects can remain a persistent annoyance. Bifocal lenses primarily offer clear vision at two distinct distances, far and near. Their potential weakness often lies in the intermediate range, meaning objects like your car's dashboard or a computer monitor might still appear slightly blurry. Trifocal lenses represent the evolution of multifocals. They introduce a third focal point specifically designed to address that crucial intermediate distance, making them exceptionally versatile and well-suited for the demands of modern life, which heavily rely on digital screens. These lenses are ideal for active individuals who aspire to achieve maximum independence from glasses for almost all activities, who regularly read, use computers, and are prepared to navigate a potential period of adaptation to any nocturnal visual disturbances. 3. Extended depth of focus, EDOF, lenses, the hybrid casual shoes. This category represents one of the newer and most intriguing technological advancements in intraocular lens design. Rather than creating multiple distinct and separate focal points, as multifocal lenses do, EDOF lenses, an acronym derived from extended depth of focus, subtly stretch a single focal point to generate a longer, more continuous range of clear vision. The result of this ingenious design is excellent distance vision and very good intermediate vision, perfect for activities like using a computer, interacting with a tablet, or clearly seeing the face of the person sitting across from you at a meal. While the very near vision, especially for extremely small print or in low light conditions, may not be quite as powerful or crisp as that achieved with a trifocal lens, potentially requiring occasional reading glasses for these most demanding tasks. The significant advantage of EDOF lenses lies in their greatly reduced side effects. They typically produce considerably fewer halos and starbursts compared to traditional multifocal IOLs, rendering them a much more comfortable and safer option for individuals who frequently drive at night or those who are inherently sensitive to these light phenomena. These lenses are often considered the all-terrain vehicle par excellence among premium IOLs, making them an excellent choice for the majority of people navigating our increasingly digital world. They are ideal for individuals who spend significant time in front of screens, drive regularly at night, and desire substantial independence from glasses, while prioritizing overall visual quality and the absence of bothersome visual disturbances over the ability to read the absolute tiniest print without any assistance whatsoever. 4. Toric lenses, the orthopedic insole. It is crucial to understand that a toric lens is not a distinct type of lens in itself, but rather a specialized feature that can be incorporated into any of the aforementioned IOL categories: monofocal, EDOF, or multifocal. A toric lens is specifically engineered to correct astigmatism, a common refractive error caused by an irregularly shaped cornea, more like a football than a basketball. If the corneal topography or tomography performed during Pillar 1's diagnostic phase clearly demonstrated that you possess astigmatism, then opting for a toric IOL is one of the most effective and beneficial decisions you can make. Undergoing cataract surgery without simultaneously correcting pre-existing astigmatism is akin to leaving a crucial task half-finished. You will still experience a degree of blur, ghosting, or distortion, and likely remain dependent on glasses to achieve truly sharp vision. Your mission within Pillar 2 is to ensure that the consultation regarding your lens choice is a lengthy, in-depth, and highly detailed conversation, an open dialogue. Your surgeon should proactively inquire about your profession, your cherished hobbies, whether it's knitting, playing golf, reading extensively, or frequent night driving, and your overall visual priorities. They must meticulously explain, with patience and clarity, the distinct pros and cons of each available IOL option as they pertain specifically to your unique case. Be inherently suspicious of any professional who simply declares, "This is the best lens," without first thoroughly understanding your lifestyle and personal needs. Flee from any practitioner who attempts to pressure you into choosing the most expensive option without providing a compelling and personalized justification for why it truly is the optimal choice for you. The selection of your intraocular lens is, at its heart, a shared decision, a collaborative effort. You bring your life story, your aspirations, and your visual preferences to the table, and your surgeon contributes their profound technical knowledge and expertise. Together, working in concert, you must endeavor to discover the perfect shoe that precisely fits the unique requirements of your eyes and your life. Pillar 3. The red and green flags, identifying trustworthy surgeons and clinics. By this point, you are well versed in the essential diagnostic studies required and have a clear understanding of the diverse range of intraocular lenses available to you. Now, the critical task shifts to evaluating the human element and the physical environment, the medical team and the facility where your surgery will take place. You have diligently completed your part as an informed and empowered patient. Now it is imperative that you ensure the professionals involved uphold their end of this vital partnership. While cataract surgery boasts an impressive 99% success rate, your individual goal is to guarantee that you do not, by virtue of making an ill-informed choice, fall into that unfortunate 1% of patients who experience complications. Let's delve into the unmistakable red flags that should prompt you to seek an alternative and the reassuring green flags that signal you are in truly capable and trustworthy hands. Let's begin with the red flags, signals to turn and run. The express consultation. If you walk into a clinic and within a mere 10 or 15 minutes you've received a diagnosis, a surgery date, and are being ushered out the door, this is a profound warning sign. A truly thorough preoperative evaluation necessitates a significant investment of time dedicated to conducting all the crucial diagnostic tests as outlined in Pillar 1, ample time to engage in a detailed discussion about your IOL options, Pillar 2, and sufficient time for you to ask and have every single one of your questions and concerns addressed. If you feel as though you are merely a number being processed along a clinical assembly line, this indicates a deeply problematic approach. The lens salesperson. If the core of your consultation revolves almost exclusively around the cost of premium lenses, and you feel undue pressure or even subtle coercion to select the most expensive option without a clear, patient-centric justification for its suitability for your specific needs and lifestyle, then you should harbor serious doubts. The discussion should fundamentally be about your visual requirements and personal preferences, not about navigating a price list. Zero transparency. When you inquire about the specific equipment used for your diagnostic tests or for the surgery itself, and you are met with vague, uninformative responses such as, "Oh, we just use the latest technology," or "Don't you worry about those technical details," that is a clear red flag. A genuinely professional and competent surgeon, one who takes pride in their practice, will be more than delighted to explain the capabilities and advantages of the advanced tools and technologies they employ. Minimization of risks. If your surgeon asserts that cataract surgery carries absolutely no risks whatsoever, or that complications never happen in their practice, they are quite simply being dishonest with you. Every surgical procedure, no matter how routine or safe it may generally be, inherently carries a degree of risk, even if those risks are statistically very low. An honest, ethical, and competent professional will openly discuss these potential risks, explain their probability, and outline the strategies and protocols they have in place to manage or mitigate them should they arise. This transparent honesty is not a weakness. It is, in fact, a hallmark of true competence and integrity. Poor communication. If your surgeon consistently fails to provide clear, direct answers to your questions, utilizes dense medical jargon without bothering to explain it, or appears annoyed or dismissive of your inquiries, then this is a significant concern. Remember, you are an active partner in your own healthcare journey, not a passive spectator. It is essential that you feel completely comfortable, respected, and fully confident in your ability to communicate openly and effectively with the individual who will be operating on your eyes. Now, let's shift our focus to the green flags, signs you are in good hands. A thorough evaluation. A positive sign is when your initial consultation is extensive, comprising a series of in-depth diagnostic tests, all those discussed in Pillar 1, and includes pupil dilation to allow for a comprehensive examination of the back of your eye, including the retina and optic nerve. This meticulous approach demonstrates a commitment to understanding your complete ocular health. The lifestyle conversation. A truly dedicated surgeon will invest significant time in getting to know you as an individual. They will ask detailed questions about your profession, your hobbies, e.g., whether you sew, play golf, enjoy reading, or drive extensively at night, understanding that these elements are crucial for recommending the intraocular lens that genuinely aligns with and enhances your unique lifestyle. Clear explanation of options. You should be presented with all the relevant IOL options, each meticulously explained with its specific pros and cons as they relate to your particular case. This includes frank discussions about potential visual phenomena like halos, the degree of spectacle dependence you can realistically expect with each lens, and the setting of realistic expectations for your post-operative vision. They empower you to make an informed decision. A coordinated and professional team. It's not just about the surgeon. The entire clinic staff, including optometrists, nurses, technicians, and administrative personnel, should exude professionalism, kindness, and competence. You should feel a sense of being in an organized environment that is genuinely centered around your well-being and clear communication. Written instructions. You should receive clear, comprehensive written instructions detailing everything you need to do both before and after your surgery. This should include precise guidance on when to start any preoperative eye drops, fasting requirements, what activities to avoid post-operatively, and for how long. Verbal instructions can easily be forgotten or misinterpreted. Written information provides an enduring, unambiguous reference. Your mission within Pillar 3 is to assume the role of an astute detective. Observe everything intently, ask probing questions, and most importantly, listen to your gut instinct. Do not be swayed solely by a surgeon's fame, extensive advertising, or lavish facilities. The fundamental relationship with your surgeon must be built upon a bedrock of trust. It is your responsibility to ensure that this profound trust is well placed and fully justified. Once you have confidently navigated and addressed the concerns of these three critical pillars and have chosen a truly exceptional and trustworthy medical team, the most challenging aspects of your journey have, in essence, been overcome. From this point forward, your primary responsibility is to meticulously follow all post-operative instructions to the absolute letter. Let's discuss the crucial steps for weeks and days before surgery. Medical control. If you have any systemic health conditions such as diabetes or hypertension, it is absolutely imperative that these are meticulously controlled and stable prior to your surgery. Elevated blood sugar levels or uncontrolled high blood pressure significantly heighten the risks of complications such as infection or bleeding during and after the procedure. Your overall systemic health plays a direct role in your eye's healing process. Medication review. This is a truly critical step. You must disclose absolutely everything you are currently taking to your surgeon, including prescription medications, over-the-counter drugs, herbal remedies, and even dietary supplements. Anticoagulants, such as warfarin, Sintram, or aspirin, may require careful adjustment or temporary discontinuation leading up to the surgery to minimize the risk of bleeding. Furthermore, there is one particular medication that every male patient with prostate issues absolutely must mention: tamsulosin, Flomax. This alpha blocker can cause a condition known as intraoperative floppy iris syndrome, IFIS, which can significantly complicate the surgical procedure. Your surgeon must be aware if you are taking this medication so they can be adequately prepared and modify their surgical technique accordingly. Ocular hygiene. Starting a few days prior to your surgery, begin meticulously cleaning the base of your eyelashes with specialized ophthalmic eyelid wipes. This simple yet effective practice significantly helps to reduce the bacterial load around your eye, thereby minimizing the risk of post-operative infection. Preoperative drops. It is highly probable that your surgeon will prescribe antibiotic and/or anti-inflammatory eye drops for you to begin using a few days before your scheduled surgery. These drops are a proactive measure designed to preemptively reduce inflammation and bacterial presence, further enhancing the safety and success of the procedure on the day of surgery. Fasting. Adhere strictly to all fasting instructions provided by your surgical team. This is crucial for your safety, as it minimizes the risk of aspiration should you require any form of sedation. Hygiene. Take a thorough shower and wash your face and hair thoroughly. On the day of surgery, refrain entirely from wearing any makeup, facial creams, lotions, or perfumes, as these can introduce contaminants. Clothing and escort. Wear comfortable, loose-fitting clothing. Crucially, arrange for a responsible adult to accompany you to the clinic and drive you home afterward. Your vision will likely be blurry immediately following the procedure, and you will not be permitted to drive. In the operating room. Upon entering the operating room, you will receive specialized eye drops to dilate your pupil and effectively anesthetize your eye, ensuring you feel no pain. The surgery itself is remarkably swift, typically lasting only 10 to 20 minutes. You will be awake but in a relaxed state, often aided by a mild sedative. You will experience no pain, perhaps only observing a bright, dazzling light and possibly a very slight sensation of pressure. The surgeon will utilize a tiny micro-incision, typically less than 3 millimeters, to carefully dissolve the cataract using a high-frequency ultrasound probe, phacoemulsification. The fragmented cataract material is then gently aspirated away. Through the same micro-incision, a new folded intraocular lens is carefully inserted. Once inside, it gracefully unfolds and securely positions itself within the eye's natural lens capsule. This incision is so minuscule that it typically seals itself naturally and does not require any sutures. You will emerge from the operating room with a protective shield over your eye, and your vision will likely be somewhat blurry. This is entirely normal. It is also common to experience a sensation akin to having a grain of sand or grittiness in your eye. Your immediate and most important task at this point is to diligently follow all post-operative instructions. Post-operative care after your surgery. Eye drops. This is arguably the most critical component of your post-operative recovery. You will be provided with a precise and strict regimen of antibiotic and anti-inflammatory eye drops to be administered over several weeks. Adhering to this schedule without fail is paramount. These drops are your primary defense against infection and inflammation, both of which can severely jeopardize your outcome. Protection. Under no circumstances should you rub, press, or apply any pressure to your operated eye. Use the provided eye shield while sleeping for the first week to inadvertently protect your eye from accidental bumps or touches during slumber. Activity. Maintain a calm and quiet lifestyle during the initial days following surgery. Avoid lifting heavy objects, bending down abruptly, or engaging in any strenuous physical exertion, as these activities can temporarily increase intraocular pressure. Refrain from sports activities or swimming for several weeks, as these carry risks of impact or infection. Your vision will progressively improve day by day, but it is absolutely imperative to pay close attention to any of the following alarm signs. If you experience any of the following symptoms, contact your surgeon or proceed directly to an emergency medical facility immediately. Intense, unremitting eye pain that is not relieved by normal over-the-counter pain medication, sudden, significant loss of vision, or a clear and rapid worsening of your vision. The operated eye becoming progressively redder rather than gradually improving. The appearance of pus or any discharge from the eye. New onset of green flashes of light, bright flashes, or a sudden, dramatic increase in floaters, specks, or cobwebs moving across your vision, which could be indicative of a potentially sight-threatening retinal detachment. Fortunately, these types of severe complications are exceedingly rare, especially when proper precautions are taken. However, being intimately aware of these potential warning signs empowers you to act swiftly and decisively should they occur, and timely intervention can make all the difference in preserving your precious sight. We have traversed a significant journey together. We have emphasized the critical importance of never underestimating cataract surgery, delved into the indispensable diagnostic studies of Pillar 1, explored how to thoughtfully select your future vision through the diverse options presented in Pillar 2, and meticulously outlined how to identify a trustworthy and competent medical team in Pillar 3. If you retain only one overarching idea from this entire discussion, let it be this: the most fatal error you can commit is to enter an operating room without having actively assumed a proactive and engaged role in your own medical process. The profound mistake lies in passively delegating 100% of the responsibility, neglecting to ask pertinent questions, failing to truly comprehend the intricacies of your procedure, and simply crossing your fingers, blindly assuming that everything will inherently go well simply because it is considered a routine surgery. My heartfelt plea, the very same earnest supplication with which I commenced this entire message, remains steadfast. Do not, under any circumstances, proceed into an operating room without having diligently verified and addressed these three foundational pillars. Do not undergo cataract surgery without absolute certainty that you have received a comprehensive optical biometry, a detailed corneal topography or tomography, and a crucial endothelial cell count. Do not proceed without having engaged in an honest, transparent, and in-depth conversation with your surgeon about the intraocular lens option that genuinely aligns with and best serves your unique lifestyle and visual aspirations. And above all, do not allow yourself to be operated on if you do not feel an unwavering, total confidence in the integrity, skill, and genuine care of the individual who holds your precious vision in their hands. Cataract surgery, when executed correctly and with proper preparation, represents an incredible opportunity, a profound gift from modern medicine to reclaim the life that blurry vision may have gradually stolen from you. Doing it well means rediscovering the joy of seeing the intricate details on the faces of your grandchildren, experiencing the simple pleasure of reading a book without strain, and regaining the independence and freedom of driving confidently. Doing it well, making the right choices, and being well prepared is worth every single minute you invest in understanding and preparing for this transformative procedure. Your vision is, quite literally, the lens through which you experience the entire world. It is far too valuable, far too central to your existence to ever treat with anything less than the utmost priority and informed diligence. I sincerely hope, from the very bottom of my heart, that this comprehensive guide has empowered you with the knowledge and confidence you need. I recognize that this is a substantial amount of information, so if you have any questions, no matter how minor or significant they may seem, please do not hesitate to leave them in the comments section. I will endeavor to answer as many as I possibly can. And please, if you know someone, a parent, a grandparent, a cherished friend who is contemplating cataract surgery, I earnestly ask you to share this video with them. By doing so, you could potentially be helping them to avoid a serious and preventable problem, and, more importantly, guiding them towards achieving a life-changing result that profoundly enhances their quality of life for the better. I am Dr. Fernando Manocci. Thank you for your valuable time, and please take excellent care of your precious eyes.